I had a radical prostatectomy, and I chose that because I didn't really have a lot of choices, although there were a number that were presented to me. That was presented as the gold standard sort of operation for someone of my age, and that although there were other options of hormone treatment, of seed therapy and so on, the only 100%, not 100%, but the only really sure method was the radical prostatectomy. The main concern I had before the treatment was whether I was going to live or die, and many of the other issues that were presented didn't really concern me that much, to do with side effects and the hospital stay and all of that sort of thing. I was really only concerned with just making sure that I chose the best option that would have the least amount of risk. I guess the erectile dysfunction and the incontinence, which are the two biggest side effects that we primarily have spoken about, and which you're told about at the point of being diagnosed, were not big issues to me. I felt that again, life is much more important, and I was going to have the operation, and if those had to be side effects, then so be it. I still wanted to have the best, most foolproof method of treatment, regardless of what the side effects were, and they didn't worry me that much anyway. I thought, well, I'm here, I've got it, and I want to fix it. I did look at or did consider the operation, and I'd had an experience with my father having the seed therapy beforehand. He was diagnosed with prostate cancer at the age of 65, and elected to have seed therapy at that time, and he was a big advocate of that, and sort of pushed that towards me and said, look, it's a great option because of your reduced hospital length stay-wise. And so I looked at that, and then really tossed up between that and the radical prostatectomy. But again, because of my age, I suppose, and a few other factors, that seemed to still come out at the end as the best form of treatment.